Bowel cancer or colorectal cancer is very common and one of the most common cancers affecting men and women in the UK. Here is what you need to look out for, and knowing this can save your life. Hello, my name is Mr. Rajeev Peravali. I'm a consultant, general and colorectal surgeon working in and around Birmingham. I specialize in the diagnosing, management and treatment of colorectal cancer. What is bowel cancer and why should you care? Listen to this. Bowel cancer is one of the most common cancers affecting men and women in the UK today. The lifetime risk of getting bowel cancer is approximately 1 in 17 for men and 1 in 20 for women. It is one of the biggest causes of cancer-related death worldwide. The important thing about bowel cancer is that if it is caught early and treated appropriately, it is curable. The majority of cancers develop from small lesions within your bowel called polyps. These polyps grow over time to become cancers. The bigger the polyp, the more likely it is to develop into cancers. This is why colonoscopy is so important, because it can identify these polyps before they become cancers and remove them. Warning signs of bowel cancer. Here is what you need to know. Generally speaking, early bowel cancers are not symptomatic, and that is why it's very important for you, the patient, to be involved in the national screening program. However, sometimes bowel cancer does present with symptoms, and these might be unexplained anemia. This is a reduction in your hemoglobin or iron levels. Now, this to you as a patient can present with lethargy, unexplained tiredness. There may be a persistent change in bowel habit. Whilst it's quite common for bowel habits to vary from day to day or from week to week, a persistent change for more than 6 weeks is very worrying and needs to be investigated. Bleeding from the back passage is also concerning and needs to be investigated further. This may be bright red blood, it may be blood that's mixed with the stools, it may be your stool changing color, becoming darker. All of these things need to be investigated further. Increasingly common within general practice is that the stool is often tested. The test used is something called a fit test. This is a specific test for your bowel to look for the breakdown products of blood-like proteins. Now, if this is positive, you do need further investigations by way of colonoscopy. The other symptom that is worrying is unexplained weight loss. This is weight loss without trying to lose weight, and also a loss of appetite. All of these things require further investigation, and you need to see a specialist. Are you at risk of bowel cancer? Listen to this. What are the risk factors for bowel cancer? Bowel cancer is more common in the older population. We are, however, seeing more and more cancers in younger patients, not just in the UK, but worldwide. A family history of bowel cancer does increase your risk of having bowel cancer too. Certain conditions, such as inflammatory bowel disease, also increase the risk of bowel cancer. Other risk factors, such as smoking, obesity, sedentary lifestyles, increased consumption of red meats and processed foods can all contribute to increasing an individual's risk of bowel cancer. What to expect if you are being tested for bowel cancer? This is for you. The first investigation that occurs during your journey is a colonoscopy. During the colonoscopy, if a bowel cancer is diagnosed, I will explain this to you, and during the test, I will biopsy the area. These biopsies will be done at the time of the colonoscopy and sent to the lab as urgent. Following the test, I will discuss the findings with you and a family member if they are present. I will explain to you that I am highly suspicious that a cancer or a problem has been found and that we are doing some urgent investigations. In order not to delay things, whilst waiting for the biopsy, I may recommend further staging investigations. The staging investigations will vary depending upon the location of where the growth or abnormality has been found. The commonest staging investigation is a CT scan. The purpose of this staging investigation is to identify whether this potential cancer has spread. Has it spread to your liver? Has it spread to your lungs? Because treatment will vary depending upon this. If the lesion is present in your rectum, I may also organize for you to have an MRI scan. The purpose of the MRI scan is to identify how big or small the lesion is, and also to see if lymph nodes around the area are affected. Should this be present, or should this be the case, treatment is affected accordingly. You may also be sent for routine blood tests during the procedure. What to expect if you're diagnosed with bowel cancer? This is for you. Following the diagnosis of a bowel cancer and your staging investigations, your case will be discussed in a meeting known as a multidisciplinary team meeting. The multidisciplinary team consists of surgeons, radiologists, these are X-ray doctors, radiotherapists, oncologists who specialize in delivering chemotherapy and immunotherapy, and together we will decide on the best treatment for you. It may be any one or combination of the above treatment modalities. How to prevent bowel cancer? Listen to this. We know that the vast majority of cancers develop from polyps. If we can identify polyps early, remove them, we can prevent cancers from ever growing. This is done through early colonoscopy and early detection of polyps. In addition, we know that colorectal cancer is more common in older age. In the United Kingdom, we have a bowel cancer screening program. This is for people from 50 to 74. Please, it is really important that people within this age range participate in the bowel cancer screening program. The bowel cancer screening program is essentially a simple test that is posted through your door. This is a stool test where you would dip this stick into your poo and send it off through your post with details such as the date it's taken and your name and date of birth. This then goes to a lab where it's analyzed, and it risk stratifies your risk of having bowel cancer. If the test is positive, a colonoscopy is recommended. You must attend for that colonoscopy to be screened. The other way to prevent bowel cancers is to reduce your risk factors. We know that having a sedentary lifestyle, being obese, smoking, and eating lots of red meat and processed food increases your risk of bowel cancer. You can simply reduce your risk by addressing these things. Put very simply, increase activity, have a healthy diet, reduce red meat consumption, reduce processed food consumption, and stop smoking.